Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And we're honored to be talking about Christ Community Health Services. We're joined by Dr. Elise Shockley, lead dentist and dental residency director, and Shamala Blackwell, site manager, affectionately known as Miss Shay. So how are you two doing?
We're doing really well. Doing well today. How are you?
Doing very well. So let's have some fun. Let's start with a little bit of history and context. Give us some history for Christ Community Health Services.
Yeah, the Christ Community was started in 1995. There were 4 doctors that made a pact in medical school to really love and serve the underserved, specifically in Memphis. And they opened the doors to a clinic in South 3rd Street in 1995. And from then we just grew and grew and grew and grew. And they went from medical to dental to pharmacy to behavioral health to spiritual health, trying to truly love and serve the patients that walk through our door every single day.
And so you have multiple sites. Talk about the different locations now.
We have a lot of different sites, and each site is a little bit different. So in total, there are 11 health centers. 6 are specifically medical centers. Then there's 4 co-located dental centers where there's a medical and a dental together, and then 1 freestanding dental center. There's 5 pharmacies, and then 1 freestanding and 1 mobile van for the homeless, and then 3 school-based health centers that we recently opened in the last couple of years.
So when you talk about obviously having the outreach for the homeless, the school-based, I think that kind of starts to illustrate the different groups that you work with, but give us a little bit of a picture of the individuals, the families, those that you have a chance to work with.
Yeah, I think both Ms. Shay and I could tell you many stories about the people that walk through our door. And the first one that pops to my head is this family that we've seen, and I've treated their kids for the last 8 years. And just the other day, they all came in, and this little 4-year-old is about to graduate from high school on a good scholarship, and English is not or was not their first language. And it was just an incredible thing to be able to witness the growth and the change of these children, that we are truly their dental home. And we have treated them from the time they were almost babies. I have treated them from the time they were almost babies till now they're grown up. And that is the ultimate goal of any dentist, is to really become the dental home for someone. So to be able to do that and to see that in different contexts, it's a privilege.
When you talk about the different families, there's obviously different needs, and that's why I think the holistic care is so important, even down to translators and different languages. And so talk about that holistic approach in terms of why it's so important to have dental, behavioral health, obviously the primary care, all of these different nuances basically under one roof, so that you can kind of step in and really play an integral part of their life and development as individuals and as families.
Obviously, there is an entire person, and no one specialty, including dentistry, which is what I speak from, can address the needs of the entire person. But an organization at large can try to do a better job of addressing as many needs as possible. We recently got social work in. We have a whole social work department that's involved in each clinic. Spiritual health, because we are a faith-based organization. So it is a neat approach. Obviously, it comes with bumps in the road, but it is the best way that we know how to love our patients well and holistically.
And to kind of piggyback off of what Dr. Shockley has stated, because we do serve the Memphis community, or the greater Memphis community, we have a large diversity. With the diversity in the patients, our dentists, we have a large diversity of dentists. We have dentists who speak several different languages. We have interpreters. So wherever the need is, we definitely have people in place who are able to assist us in meeting that holistic approach for each of our patients.
Carry that forward, because I think that is a neat element of your team, is that you talk about the diversity in the community in terms of those you serve, but your team is very diverse. And so carry that forward in terms of what diversity means internally.
One of our dentists that we're privileged to work with speaks 4 languages. And one day at the end of clinic, he was like, Doc, guess what happened today? I spoke all 4 languages. And that's just a great picture of our patient population, and also just the privilege of the diverse population we get to work with and work to serve for. And I'm privileged to be able to work with someone like that does speak 4 languages and can be able to serve and love in that capacity.
Yes.
Absolutely. So talk about, because you mentioned your vantage point, obviously on the dental side, go ahead and talk about why oral health is so important and is such an integral piece of the equation for Christ Community Health Services.
Yeah, that's huge. I think there's just more and more research coming out that explains why the oral health is so important for your overall health, because it's not just fixing teeth. Historically, it's been like, oh, your tooth is bad, pull it out. There's so much overlap. Your teeth is a part of your body. And if you don't have your oral health under control, it can affect your heart. It can affect your diabetes. It can affect all sorts of other parts of your body. It can even affect self-esteem, right? Like I've had so many patients that come in and they're like, Doc, you got to fix my front tooth. I have an interview tomorrow. Or when they get a set of dentures, they can smile for the first time in 50 years because they've never had straight white teeth. It makes a huge difference, and people don't realize just how much of a difference that is. I'm sure you've heard stories, Michelle, from the front side of things about people and how important oral health is.
Yes. And also that is why here at Christ Community, we do our best to try to do medical and dental integration. So, and to assist our patients in keeping that continuity of care and to treat the overall body, because as Dr. Shockley has stated, your oral health is directly tied to your systemic health. The mouth is the gateway to the systemic system. So everything goes in through the mouth. So you want to have a healthy mouth to assist you in your overall health.
That is a really neat piece of the equation. To your point, is the fact that it is integrated. So you can be having those conversations around, okay, here's what we're seeing with the oral health. Yes. Let's tie this in over here. And even with the spiritual side too, you can really kind of come in and pull in all the different, experts in, and obviously help in a very, once again, holistic environment. So it's not individualized. I mean, it is for the individual, but it's all the way wrapped around in terms of what does it mean for their primary health, their spiritual health, obviously their oral health, everything combined, which is really cool.
Yes, that's the goal. Yes, sir.
Absolutely. That's the goal. So talk about partnerships. One of the partnerships is with Delta Dental of Tennessee and the Smile 180 Foundation. Talk about what that partnership means to Christ Community Health Services.
It means the world. Like, our partnerships are the reason that we're able to serve who we serve. Because if you go to a private practice dentist, it costs a fair bit of money. A lot of our patients cannot afford to change their smile, to treat the oral health conditions that truly affect their diabetes, their heart problems, because they don't have the money. And so to be able to have partners in place that can help supply some of the needs to offset that funding so that we're able to provide high quality care, really high quality care to the underserved. And our mission statement is to provide high quality care to the underserved in the context of distinctly Christian service. We recognize that Jesus Christ is the true healer of individuals and the source of our ability to serve. And that's what we want to do, but we can't do it without partnerships. And I know even Delta Dental, they just donated us to have a whole new operatory. That's a whole bunch of patients. If you calculated that a year out, I have no idea how many it would be, but tons and tons and tons of patients that we would not otherwise be able to see because we didn't have that operatory in place.
Give us an illustration like that in terms of some of the specifics, a couple of just illustrations in terms of the way that the Smile 180 Foundation, Delta Dental Tennessee, has been an integral part of your success.
I think the biggest one that comes to mind, and Michelle helped me out with this, is that the Delta Dental has donated not only equipment, but also oral hygiene supplies. And there's people that really don't have the funds in order to get those oral hygiene supplies at home. So like, a lot of people don't think twice about buying new toothbrushes. But if you have your toothbrush and it's worn out, you're supposed to toss it out. But if you can't afford a new toothbrush, then you don't toss it out and then you come and see us. We have now had the ability to give you maybe even 3, 4, 5 toothbrushes that you can use at home. I had a kid the other day that I was asking them, I was like, when you brush your teeth, how do you brush your teeth? Walk through that. And he's like, well, honestly, Doc, when I'm at my mom's house, I brush my teeth because my toothbrush is there, but we can't afford a toothbrush at my dad's house. And I was like, will you brush your teeth if I give you 5 toothbrushes and you can have them wherever you want? You can keep one in your backpack. And he was like, Doc, that would be great. Like, it's a toothbrush. A lot of us don't even realize how important that is. And he was so excited that I could give him a couple toothbrushes that he could have at multiple homes. And it seems so small, but Delta Dental donating all of this home care stuff is huge. It's huge to our patients. It's huge to us. That was the first patient that popped in my head.
Yeah, and I think that's a great illustration of something so small in some cases, like a toothbrush, but yet so powerful in terms of the impact, especially for that child. We don't realize, in other words, these huge gaps in our community that are going and creating these challenges. And it's something that we can step in, like you're saying, and one, just asking the right questions. Hey, why is this happening? And two, being able to have a solution and say, not just 1, but 5, like, let's take care of this, to really put their health on the priority. So I think that's a perfect example. Give me one more illustration when you talk about the equipment side. I think something that's been really interesting for me is when you talk about equipment and having state-of-the-art equipment, what that allows you and your team to do, but also the statement that it makes for your patients to be able to walk in and see that they're getting the latest and greatest technology. What does that mean for you and your team, but also for the individuals and the families that you serve?
Yeah, I think historically, FQHCs, which is what we are, a federally qualified health center, or health clinics in general, have had a name of being like this grungy last option for patients. And we want to give dignity to every single person that we see. And in order to do that, to have a really high-end and state-of-the-art facility, which we do thanks to partners like Delta Dental, we're able to, I really think, bring more dignity to every single patient that we see. And that goes from every little thing. It's not only just the facility, but also the love that we give our patients, from Miss Shea when she's working at the front to the assistant that speaks multiple languages and able to communicate in their native tongue, to a doctor that might also speak languages or has given the extra mile to like pray with a patient or listen or follow up on other things. I think it's the whole picture of dentistry and the whole picture of the patient to truly bring dignity to every individual that walks in through our doors.
Yeah.
And I think about the new CBT machine with the 3D X-ray. It gives us the ability to look at 3D pics or pictures for diagnostic purposes and other things. So when the patients, they walk in, it's not the clinic feel, so to speak. They're really feeling valued with the high-tech equipment that we have here in our office. A lot of times they don't expect it, and when they see it, it kind of pours back into them as well, like we are caring for them.
Absolutely, they deserve the best.
Yeah.
So talk about how other companies, individuals, how can the community support your efforts?
We can use all the help we can get. Obviously, financially, we are trying to offset the cost of treatment, specifically dental treatment in my case, but truthfully, also medical treatment, behavioral health treatment, all of these other things. We're trying to offset that cost so that we can give it at the lowest possible rate in order to provide even more care to more people. So any financial contributions that foundations or individuals can give would be hugely helpful. But the other way is, we have volunteer opportunities, we could use information, infrastructure, there's other ways to be involved besides finances. Even if it's just volunteering with some of our outreach days, or when we had an awesome picture of really serving our community when COVID hit. And we took the lead on really doing a lot of the COVID testing and all of that. but it was everyone. There was Memphis Health Clinic, there was UT, there was all sorts of people really getting involved and loving our patients through doing a lot of COVID testing. And I think that's just a great example of how it's not all about money, right? We want to partner with people and organizations in order to make healthcare better for our patients.
For each of you, what puts a smile on your face? What lights your fire in terms of fueling your passion to do what you do? So in other words, what's the favorite part of your job?
The patients. And it's really on a daily. I actually had one just earlier today, an older patient of ours. She had gone to the back and she was getting ready to exit. I was on the phone as she was on her way out the door, but she had to wait. She wanted to wait to speak to me, and she just would let me know, like, I just love coming to you all. You all provide me so much joy. And she was just so excited. She hasn't even gotten her final smile yet, but she's just going through the phase of it. But she was just so excited. She just loves to come. After she spoke with me, she said, I'm just going to sit here a minute because I just love being around you all. And it really is. It's the patients. When the patients, you feel the appreciation from the patient. And for me, that's what it's all about. That's what it's all about. Giving them that confidence back, giving them that smile, and making them feel good about themselves, and going out into the community and, being productive and being confident about it. So it's the patients.
Yeah, and I would have to echo that. I think to get the privilege of really hearing from people, and people tell their dentists all sorts of things. This is what I've learned in my years of practice. People talk to their dentists, and that's a privilege, right? That is a privilege that I don't take lightly. That I get to hear parts of their story and be a part of the story, and hopefully to be a part of the solution to at least a small part of their story. But just to hear and to listen to people's stories is incredible.
Awesome. I love it. Wrap up with website, contact information. Where do we go to learn more about Christ Community Health Services?
So you can go to our website at christcommunityhealth.org. The website, it gives you all the opportunities on how to give, employment opportunities, everything that Christ Community, our different locations, it's on our website.
Well, I definitely love and appreciate everything you're doing to make a difference, and you are making a huge difference indeed. So thank you for all you do to power the good. Thank you for coming on the show.
Thank you for having us.